Welcome to BrainMindia Homeopathy Neuro-Psychiatry Clinic. Today I will discuss on bipolar disorder. It is a psychiatric disorder, mental health issue, and nowadays it is very prevalent across the nation as well across the globe. Two types of symptoms are experienced by patients: maniac symptom and depressive symptoms, low mood, alternately high mood. So when people come to us, they say elevated or irritated mood syndrome, sometimes we in the heading of maniac psychotic symptoms. Sometimes they say low mood, sometimes they say loss of energy, fatigue, so impulsivity and poor judgment. So when these kind of alternating symptoms appear, we consider this disease as bipolar disorder. It is a mental health condition which causes severe mood destabilization, and when depressive symptoms aggravate, patient experience sleep disorder, changes in appetite and weight. This disease can well managed through homeopathic constitutional medicines. During maniac episode, when a patient comes to us, they say elevated or irritated mood, increased self-esteem or grandiose sense they experience, and when they stay in depressed episodic stage, they say difficulty concentrating, they say they are having difficulties in making decisions, they are having feeling of worthlessness and excessive guilt feeling. So we consider this disease as bipolar disorder. We start giving medication through homeopathy, and patient can well manage. But I can tell you that bipolar disorder is completely curable through homeopathic medicines. Before coming to the treatment protocol, I can tell you that the cause of the disease is very important. Imbalance of the brain neurochemistry, changes in neurotransmitters, especially dopamine and serotonin impairment. There are also some developmental disorders, maybe some family history of bipolar disorder can trigger the risk factor of the disease. Diagnosis of bipolar disorder is comprehensive, because we have to diagnose the case through various kinds of case history modification, and before giving treatment there are several procedures: cognitive behavior therapy and various kinds of expressive supporting psychotherapy helps well to manage bipolar disorders. One thing I can tell, not every patient is required medication, homeopathic medication. If in due time patient can take clinical psychologists' help, they can take helps from psychotherapists, the disease can be well managed without medication. But when the condition aggravates, patient has to consider medicines. Before come to the medicinal part, I can say the treatment protocol of bipolar disorder. Actually, mood stabilizers are used, and some antipsychotic homeopathic medications are used for treatment. Besides, I have just said that cognitive behavior therapy, which is commonly known as CBT, works well if it is taken with the guidance of clinical psychologist or psychotherapist. It works wonder. Family focused therapy is also useful. Social rhythm therapy, interpersonal therapy, these kind of therapies are very helpful along with medications. So lifestyle management is also required, because regular exercise, maintaining daily routine, balanced diet, adequate sleep, stress management are essential for stabilizing mood. So we insist patients to do all kinds of lifestyle management procedures to maintain all those things, besides having homeopathic constitutional or therapeutic medicines. Actually, one interesting thing is that with the help of Agnus cactus mother tincture, I get brilliant results in acute cases in bipolar disorders. But constitutionally, I consider preferably aurum metallicum 10m or nitric acid 10m. It works wonder, and within 5 to 6 months patient gets cured. So nitric acid 10 m or aurum metallicum 10 m single dose every day for 15 days works well, and subsequent follow-up in follow-up visits we consider lac caninum 1 m or rather lower potency 200 potency if given, and they get wonderful response. They feel that their mood has been stabilized and all kinds of symptoms has been reduced within a short span of time. Some people say it is a lifetime condition, it cannot be effectively managed, but through homeopathic medicines along with therapeutic procedures and lifestyle management, we can well manage this disease for the rest of his life. Thank you for watching this video. Thank you.